This is the COVID-19 monitoring dashboard. It is designed to help a center nurse manager at an assisted living facility to monitor and triage senior residents for COVID-19 disease progression. The COVID-19 monitoring platform is a three-pronged solution. It consists of the smart fingertip pulse oximeter, the nurse's app, and the clinical dashboard. Every patient has their own pulse oximeter. The nurse uses the nurse's app to connect with the patient's devices and collect patient vitals and symptoms 1 to 3 times daily. The clinical dashboard then collates this information and computes the COVID-19 early warning score for each patient so that the nurse manager can make a clinical decision on whether a resident requires additional medical support such as a GP appointment. Now, let me show how a nurse manager will use the dashboard during a typical session. The triaging dashboard lists all the patients in the given facility in order of priority based on their COVID-19 early warning score and symptom history. Additionally, the patients are color-coded in 3 categories. Red for patients that have jumped across EWS categories and need immediate care, green for patients that haven't been reviewed yet this week, and white for patients that have already been reviewed. The nurse manager clicks through all the red patients first and reviews them. This is followed by reviewing the patients marked in green until every patient on the list has turned white. Once the nurse manager clicks a particular patient, the patient's historical vitals and symptoms show up on the right, indicating both immediate and historical changes. Using the historical data, the nurse manager identifies the episode that resulted in high early warning scores and takes a clinical decision on whether the patient needs additional attention from a GP. If yes, the nurse manager presses book appointment to book an appointment for the patient or book telehealth appointment to book a telehealth appointment for the patient. If no further action is recommended for the patient, the nurse manager presses patient has been processed. For any patient who already had an appointment scheduled, the nurse can indicate that they have returned to the facility or have been removed from the facility after their appointment. To sum it up, the COVID-19 monitoring platform is an end-to-end EHR integrable solution that helps a nurse manager deliver complete COVID-19 care management for its residents.